So first of all, thank you for being here. We're going to hear a little bit from Joe Judge, the mayor of the city of Mount Carmel, Judy Wissel, the administrator of the Wabash County Health Department, Sheila Wallace, the vice president, commercial loans, First Mid Bank, Karissa Turner, president and CEO, Wabash General Hospital, Ryan Masterson, partner with Kemper CPA Group. So thank you all. And Joe, we'll go ahead and let you begin. You can give us an update about the city and maybe tell us what we should be doing, what we shouldn't be doing, and what we should expect for the future.
Here at the city of Mount Carmel, currently our lobby is closed. We are looking at potentially opening it up in the beginning of May if the stay-at-home order is lifted. During this time period, we have continued operations as much as normal as possible. We still providing all the services and everything else and continuing on looking at our projects that we had planned prior to this epidemic or pandemic. Following along with a lot of stuff that Judy will talk about and Karissa will talk about as far as the IDPH and the CDC recommendations about, washing your hands and, social distancing and things like that. Like right now, we, as far as the outlook of what's going to go on in the near future and stuff, very fluid situation. It changes sometimes hour by hour. The majority of the time it's, day by day on what the president and Governor Pritzker released to us on what the next steps are. So they hopefully will get a reopening plan sometime in the near future. We were hoping it was going to be about this time period because a couple Sundays back, Governor Pritzker had announced that we had already hit our peak and we'd been over it, and then apparently we hadn't been, and so he's kind of pushed things out now for our peak to hit in mid-May. So we're kind of waiting to see within the next week. Could happen tomorrow as far as him announcing what restrictions he might lift and what he's going to continue on, for the next couple weeks. So that's about all I got right now.
And just kind of wait and see and roll with the punches.
That's all we can do.
Yep. Thank you, Joe. Next, Judy Wissel, do you have an update for us and all the things that we need to know and be doing?
Sure. Well, as you can imagine, it's been quite a journey for the health department. We plan and train for these kinds of scenarios all the time, but nothing is quite the same as the real thing. So we've learned a lot of new lessons in the whole process. The function of the health department is to provide safety and a healthy environment for our community. So that's kind of what's being put to the test during this whole pandemic. We've been involved with the whole thing since about January, but it didn't really, with webinars and things like that, but it didn't really kick off big until March. And we set up an internal incident command. And then countywide, about a week later, we set up a whole unified command that has people on it from all over, all different kinds of vocations in the county. And we've also been, now that was the bug man that came in. We've also been involved with distributing the personal protective equipment for the county. So long-term care facilities, group homes, some businesses that are essential, the hospital, the school districts for their food service and things like that. So, and that's been pretty frustrating. I know that you've all heard on the governor's addresses that he's sending out PPE all over the state in mass quantities. We're not seeing that down here. We're just getting some limited, what appears to be the leftovers. So we've gotten a whole bunch of gloves that are size extra large and different things like that that aren't necessarily what we need down here. We keep posting things on our Facebook page, and then the Unified Command has an additional Facebook page that we're putting information out, and we're pushing other information out that as it comes down from the state to different kinds of businesses, daycares, funeral homes, any kind of guidance that the IDPH sends out, we're forwarding that along. Of course, we are charged with the duties of making sure people comply with the governor's ordinances. But then if our phone calls and visits don't work, then we have to get law enforcement involved. So there are steps for that. Internally, we've kind of changed up how we've done some services. We're doing curbside WIC now. So moms can just call ahead, do the appointment over the phone, and then just swing through the driveway to pick up their coupons. The depot has been extremely busy. People are feeling the stress and anxiety from all of this on top of their other mental health issues. And then we're also participating. We're one of the agencies that's on the governor's Call for Calm that they set up, the texting services. So people can text the word talk to that number, and then we follow up with them within 24 hours. We have to follow up with them. So we've been busy, needless to say.
Judy, do you keep fully staffed then?
We let some of our non-essential staff take some time to work from home. We've been slowly bringing some of those back as the workload continues to increase. A lot of our people are working under a grant program, so we still have to complete the deliverables of those grants. So what they can't do at home, then they've had to come back in to do. So like I had my census, the person Tristan that does our census stuff, she was working from home, but she's been back this week because we're doing some activities, related to that. Taking some, yesterday we did a drive-through boredom buster bag for kids. Parents just drove through and picked them up, and it had some activities and things in there related to the census for them. And they're going to Albion and Allendale, I think, tomorrow and Monday. And then we've been trying to help coordinate people's questions. You can imagine there's lots of questions that people have, or if they see a business that they think is supposed to be closed that isn't, then we have to field all of those calls too.
Mm-hmm.
So.
Do you have any helpful hints for the public or businesses, or what can we be doing? Just following all of the guidelines for social distancing? Is that the main point you would want to bring home?
Yeah, that, and just making sure if you're sick, don't go anywhere. Call your doctors before you go there. We're fortunate to have Wabash General doing the testing right here in town, so people can get tested if they need to. The state has kind of encouraged more testing recently, so I think people that feel like they have some symptoms can get tested really easily, and it's a quicker turnaround than it has been. There's been a lot of questions to us about should we wear a mask in public, and the recommendations from the CDC is that if you're going to be in an area where there's a community-based transmission, it's recommended you wear a mask. So if you're going to go somewhere that's, a Walmart in a town that's got multiple cases, then that would be a good idea. But I think we're pretty safe not wearing them unless you're in close contact with a lot of people in our area. So you'll see some people with them, some people not. I always am amazed at the people that wear them, but wear them on their chin instead of their nose and mouth. So that's not how you wear it. And of course, we have to keep the mask for medical use, the ones that we get. And then we've had people, the Area Agency on Aging has donated masks to us and a few other people in the community. So if people want one, we've got a few that they can have, but mostly we're just recommending people wash their hands, stay home if you're sick, don't go to big crowds.
Mm-hmm. So if, I don't have a mask currently, but I have like a handkerchief or something.
That works.
That'd be a good alternative.
Yes, I've even seen people, if you cut the sleeve out of a t-shirt, you can use that, pull that up over your face, and that works. Any kind of scarf, bandana, anything like that will work if you need a mask to go out in public.
Well, I'm not going over to Walmart, but I do have to buy groceries at Beeler's.
Well, yeah, I know. Everybody has to buy groceries, so you have to get out.
Especially with 2 teenage boys sitting at home.
Absolutely. Yeah.
Thank you,
That's nice.
Judy.
You're welcome.
Sheila Wallace, do you
Yes.
have an update on all of the loan things that we need to know?
Sure. Obviously, our lobbies are currently closed and a majority of the business is being taken care of through the drive-through. The lobby is open by appointment for people that need to come in for lockbox. There might be some business that they just need to do face-to-face. So we can take care of that by appointment. So we're very thankful for technology in this day and age because we're sending a lot of emails, just that's how we're doing a lot of business is texting people or emails and when you can't do the face-to-face. So we've not seen a lot of fraud yet, but we're anticipating with the increase in the stimulus checks coming out and unemployment, there will probably be an uptick in fraud. So we're really encouraging businesses to monitor their checking accounts, well, all accounts in general, and even individuals. You really need to monitor your accounts, especially for businesses, because if you have a fraud check that comes through, you've got 24 hours to return that, or else you could be liable for that amount. So people really need to monitor those.
Yeah. Are you there? Did it freeze? Lindsay?
Me? I don't hear her, but I see her moving.
You see
I
me?
can hear you, Sheila.
Okay.
This is Ryan.
Can you hear me?
Froze for my
Yeah.
side froze for a
I can
minute.
hear her.
Okay, I'm back in.
Can you hear me?
Yes.
Okay, great.
So you were saying that 24 hours is the time frame you need to report
businesses.
fraudulent usage on your checking accounts?
On business checking accounts, yes.
Good information.
I would monitor those very closely. Also be very cautious of emails. We've had an instance where a business owner sent someone else that they do business with, they sent them an email requesting that they get a cashier's check. We'll come to find out that initial email was not from who it was supposed to be from. There was just a small change in the email, so be very mindful of who you're dealing with. So really look at your emails. And then the big thing here lately has been the payroll protection program. That initially opened up on Friday, April 3rd, and it ran out of money on Thursday, the 16th. So we are waiting now for that program to get funded again. During that time, First Mid, we did within our whole bank, we did 1,350 applications, and that was worth $220 million. And so the whole purpose of that program is to keep people employed. So when you think of all the people that are benefiting from being able to keep their jobs because of that program, that's pretty powerful. So First Mid is an SBA lender. So when that opened up, we were able to just jump right in and start keying in applications. And kind of to give you guys an idea of the process, for us, we key the application in, we get an immediate response as to whether it's approved or rejected. And then the bank has got 10 days from that date of approval to get your loan documents signed and back in. And then once we get your loan documents, you get them back to us signed, it's funded that day if you get it to us early enough in the day. So
Wow.
it's a pretty quick turnaround. But we're thinking that possibly there will be more money. If not tomorrow, it'll be early next week.
So if a business is struggling, they can have a pretty quick return if they're doing all the necessary steps with their bank.
That's right. Yeah.
That's great.
And, we're not going to guarantee, because just like the last time, we had applications still that we couldn't get keyed in just because the program ran out of money. So,
Yeah.
But if, if they can get everything together and have it all together ready to submit to us, then they'll be steps ahead.
Great. Thank you, Sheila. Karissa Turner?
Thank you, Leslie, for having me today. So Wabash General Hospital, we've been very busy since really March the 10th. That's when we started our incident command here at WGH. The things we've implemented are to protect the health and well-being of the community. We're trying to make sure that the community knows that you can still get safe care here at Wabash General Hospital, even with COVID. We've implemented a lot of safety measures to protect our staff and the people coming in for services non-COVID related, such as universal masking. That's something that we started with a cloth mask here. So if you come into the hospital or any other doctor's office, you will be issued a cloth mask if you do not have any symptoms. If you're just a visitor, if you're a patient with symptoms, you'll be given a ear loop mask. And what we do for the cloth mask is we ask for those individuals to return them as they leave the hospital, and we do properly launder those. So we've implemented that as one measure to protect our patients. We're also offering curbside testing for COVID, and you can do that with a physician order. You can get a physician order through calling our nurse triage hotline that's on our Facebook account. And it's a very simple process. We have standing orders with our physicians that the nurse can go through step by step what you need to do. And if they feel like you need to be seen, then we ask for you to come into our respiratory clinic for a face-to-face appointment. We have our respiratory clinic open 7 days a week. It's where convenient care was previously located, and there's a separate entrance. So you do not walk through the hospital. You do not walk in any doctor's office. We're funneling all of the respiratory patients as much as we can through the respiratory clinic. And what that does is it consolidates everybody to one area. And we have a negative pressure room set up. If we feel like you are a PUI, you would be sent to a negative pressure room. And all of our staff would be wearing proper PPE. So we've implemented a lot of measures to keep people safe. We did remove the tent out front of the hospital. That was mainly a screening tent. We did not treat any patients in that tent. So what we were doing was trying to direct traffic that if you had respiratory symptoms, we took you in a side door and not through the hospital so that we could treat you there. But we feel like our signage and communication has been effective enough that people are understanding that they either go through the side door or have curbside testing. If you have a curbside test, it doesn't necessarily mean that you'll have a COVID test. So there are other viruses that we need to test for first to rule out, to make sure that you don't have the flu or strep or RSV if you're a child before we do the COVID test. The COVID test is not a fun test. It's a nasal swab. So we do stick a swab very far up the nasal cavity. So it's not something that you want to go through unless you really have to. And we do get results pretty quick. At first, it was taking about a full week plus to get testing results back. And that was through the private lab and through IDPH. But now we're seeing about a 1 to 2 day turnaround time. And we are working with our lab manufacturer to see if we can get reagents and if we can get a new analyzer to do testing here in-house at the hospital. But right now, all of the reagents are being shipped by the government to hotspots. So even if we had the ability, we're not going to get our hands on the supplies. And that's one of the things I've been working with the state IHA on, is stating that rural areas need to have the ability to test in-house just so we can protect the community moving forward. Some other things that we implemented here: if you have an appointment, a well appointment at one of our clinics or any type of appointment, we ask for you to do a curbside check-in. And that way we come out and get you from your vehicle and bring you straight back into an exam room. So you're not sitting in a waiting room with other patients in close proximity. And we're also offering curbside labs. So you do, and that's behind Dr. Jennings' office. You pull up, you check in, and we take you into a private office to do lab draws, so you don't have to come into the hospital. So we are providing a safe environment. We're cleaning as much as we possibly can. All of our staff are masked at this time. We do not have any positives currently in the county, so we're just doing this as an extra protection for the community. We have tested 169 individuals, here at the hospital so far. That's from Wabash, Edwards, White, and some surrounding counties. We currently have 7 tests pending. So we're seeing just a handful of phone calls and tests happening each day, somewhat of a decline really over the last couple weeks. And we're seeing about a handful in our respiratory clinic as well. So we feel like we're ready to start opening up our doors again safely. We have the proper PPE here at the hospital that we feel like we can go ahead and start elective surgeries here safely. Our tentative date is May 1st. There's a series of things that we have to do here at the hospital to be compliant with starting elective surgeries again. We have to form a surgery committee. We have to develop new processes and protocol, and we've been working on that all week. So unless the governor states otherwise, our reopen date's May 1st. The Evansville market, they started this week on April the 21st, and we're closely monitoring how their workflow and processes are, because they do have COVID inpatients in their market where they're doing elective surgeries. So we do not have anybody here in-house at the hospital inpatient at this time. So we're kind of taking some of their lessons learned and implementing those here. But the main priority is just making sure everyone has access to care in a safe manner. We also offer virtual visits. So you can not even come into the hospital. You can call your specialist, your primary care doctor, and request a virtual visit. And we have those set up, and we have virtual visits set up for our inpatients as well, because we have restricted our visitor hours here. We're trying to limit those, just limit the traffic in the hospital right now. And we do have iPads issued to our patients if they would like to have FaceTime with their loved ones. So a lot of changes here for the hospital. We did send quite a few staff members home just due to the fact our volume was way down, but we're starting to bring people back. We have a resource pool, some job duties that people would normally not do, such as our athletic trainers, since the schools are closed and will remain closed. They've been working in our dietary department. It's been quite interesting seeing some of them with hair nets, serving food and taking our money through the lunch line. But everyone's really came together here at Wabash as a team and willing to do whatever it takes moving forward. So I'm really proud of the individuals we have working here, and they've been extremely supportive.
Karissa, have you guys stayed fully employed? You know, you've kept all of your employees and everything?
We did not lay anyone off. What we tried to do, we reduced hours in many circumstances. Some areas had a higher demand for staffing, and some, due to no elective surgeries, had no work. So we reduced hours, but we're starting to bring people back and reassigning them new job duties. We have screeners at all of our front doors, and they screen for temperature and symptoms before we let people in the hospital. So we've created some new positions that we've been able to give people work that they wouldn't otherwise have.
Mm-hmm. Thank you, Karissa.
No problem.
Ryan, do you have an update of all the tax things we should be doing in our businesses?
Yeah, so probably just, I guess, a few highlights, because there are kind of a lot of things going on right now. And Sheila kind of hit on probably the most all-consuming thing that we've got to deal with right now. So besides those initial applications on the PPP loans, a lot of people have received those now. And especially for those that had people laid off, the question is, what's the optimal level to bring people back at? There are a couple haircuts in the PPP loan where you might not get full forgiveness for everything. One of those is a full-time equivalent calculation. And then so basically there are a couple base periods that you look at from historical periods. You look at the number of FTEs that you have, and then the number of full-time equivalents that you have for this 8-week period. And you can potentially get a lower level of forgiveness with that. The other issue is if you have any employee who receives less than 75% of their compensation from what they did in the a quarter immediately prior to you receiving the funds. If they go below 75% of that comp amount, you can potentially get another haircut there. And so what that means is, well, and I guess adding on to that, 25% of your forgiveness amount on that PPP loan is eligible for things that, you know, we would consider to be overhead, like mortgage interest, rent, and utilities. So there is a little piece of that the employers can get some help out on, especially in situations where they don't have revenue. So the challenge right now is, if we don't have everybody on payroll right now, we receive the funds, how do we forecast out the optimal, you okay?
I dropped my clipboard.
Okay. How do we forecast out what our optimal level to bring people at is? And it's not necessarily a no-brainer to bring everything back at 100%, because one of the considerations that you have is that for payroll cost wise, gross payroll is includable, and then health insurance and retirement costs are two things that are not included. Is the employer cost of FICA, so the employer Social Security and Medicare cost, 7.65%. That's not a huge number, but it's something. And then in some industries, and so the employer isn't reimbursable on workers' comp insurance. And so in some industries, you know, those rates can be 20% or more of what you're paying out in payroll. So kind of looking at that total cost of what it is to bring things back, and then whether or not you actually have work for people to do is part of that consideration. So trying to forecast those out, like an example would be restaurants. Okay, so restaurants may not have the full staffing need right now, but if they've got a PPP loan, obviously they can afford to bring more people back. One of the situations you can run into there is, well, do we just bring people back and have them standing around? Because we've got to get to the FTE count, and we also have to get to that 75%. Sometimes the answer is there, if we're just doing carry-out type items, maybe we need to reduce everybody's hours across the board, give them maybe a couple dollars an hour, or a temporary payroll increase. So we've kind of got rotating shifts of people that we might have previously had everybody laid off. Maybe we bring everybody back and we're at 80% or 90% of where we were. So everybody's getting some benefit. Nobody's laid off. And we're still not really staffing a lot more than what we've actually have work to be able to do. So that's kind of a deal that on initially looking at the face of the calculation seems like it's not a big deal, but when you start thinking about having to do calculations on individual employees over a prior quarter compared to where you're going to get in the 8-week period, that can be a deal where you've got, you know, depending on the number of employees you have. For something else that's important, so people that, if they don't get full forgiveness on any of those, it ends up being a 2-year loan at 1% for the non-forgiven portion. I think the expectation is for most people, if any portion of it you just physically can't get enough costs in to get it forgiven, probably once you know your forgivable amount, you'll just pay the balance off, right? There's also the economic injury disaster loan. Those applications went out. That's what, if somebody saw a lot of the $10,000 advances people were applying for, they've put out just in the last few days more information on that, and so it's not just a blanket $10,000 advance that you don't have to pay back. They set some criteria after the applications were out there for a while, and the latest that we've seen on that is they're essentially giving $1,000 per, if you applied, they're giving $1,000 per employee, and then those funds would offset your forgiveness on the PPP loan if you used it for the same purpose as costs of what you did in the PPP loan. So if you use the $1,000 they gave you, or the $3,000 depending on your employees, to use that to cover payroll costs, that would reduce forgiveness on the PPP if you had that. And then the EIDL, and that's an application directly on the SBA site. And Sheila may have more info on this too, but I actually saw today the actual calculation. So the EIDL loan that you could get, not the necessarily forgivable part, but just an actual repayable loan that was up to $2 million. The calculation that I saw today from SBA was that they're basing that on 2 months of working capital up to $15,000, right, as an initial. So like a 2 month of working capital number is like the base of what they're doing there. That's kind of late information for a lot of people that applied for loans weeks ago through the SBA directly, but it is a good thing for those that applied and had employees. I think we've had some that just today started getting some of those deposits. Self-employed people, so if we're thinking about unemployment, well, I guess self-employed people, if we get a second round of PPP loans, they're probably going to need to try to apply for some of those if they haven't already. And then the other thing is, well, if you're self-employed, we've heard about self-employed people who were typically in the past not eligible to apply for unemployment. They've opened that up for them. And the reason they weren't able to apply in the past is because we didn't, self-employed people, if you're like a sole proprietor, you didn't pay into unemployment. And that's how you get benefits out. Well, they've opened that up, and Illinois, from what I've read, they're expecting to have the portal and the applications open to be able to go apply and get those funds by May 11th. And so that would include the federal stimulus unemployment that's $600 a week for up to 13 weeks. That only goes through July 31st. So, if they open that up for the self-employed, if they don't extend that July 31st date, they won't quite be eligible, or maybe receive 13 weeks, I guess, but there's at least quite a bit out there. Individual stimulus, the way that's working, it's $1,200 per adult. You don't have to go out and necessarily file anything to receive it. One thing, and the way that that's based is if you're single and your AGI is less than 75,000 or married filing joints under 150, then you're going to be eligible. It's $500 per dependent child that you've got. And the way that they're basing that, so I guess one tidbit of a planning point for some people may be if you haven't filed your 2019 return yet and your 2018 return was under those limits, but you think your 2019 is going to be over, you could wait to file that 2019 return because they'll issue it on either 18 or 19, whichever was most recently filed. If you're the inverse of that and you would not qualified in 18, but you would have in 19, you probably wanted to go ahead and get it filed quickly so that you would get the check now. But if you don't receive it and you would have qualified when you file your return next spring, so it would actually be for the 2020 year, if you should have received it and didn't, then you will actually get the credit on your individual return then. And if you got the credit now and shouldn't have, either because they based it on a past year and then you ended up not being eligible in 2020 or something, you don't have to repay it. So that's kind of like a flow chart, I guess, but that's the lowdown on those major items. PPP probably being the biggest.
A lot of really good information. Thank you, Ryan.
Yeah.
Right now, I don't see any questions in chat. If anyone does have a question, please post it there and we will see if anyone can answer it. I had a couple of updates that I will say while we wait to see if we have any questions. As you guys all know, yesterday would have been Administrative Professionals Day. So we would have normally had our big luncheon on yesterday, and we were unable to do that. We had initially rescheduled the luncheon to be on May the 13th. And unfortunately, we do not feel like that'll be a good idea to get a large group of people together at that point. So we are going to combine Administrative Professionals Day Luncheon and the Chamber Picnic together this year in hopefully June. So you'll look for an invitation for those events later in a Chamber newsletter. All mixers are on a hiatus until at least June as well. We just don't want to start getting people together at this point. We are hopefully going to stay on track with the Chamber golf outing on its rescheduled date. It was originally on May the 1st, and we have pushed that back to May the 22nd. We're hopeful to continue that, but like Mayor Judge said, we're just gonna have to wait and see. We feel a little bit better about that though, because it would be out in the open and not just confining people into a room. The Chamber membership directory, we are wrapping that up. We did have an extension on that, which was inevitable, because even if we had the directories in hand, we can't hand those out because then they would be, contaminated, and then it would basically be a one-use publication, and that's not what we're hoping for. We hope people hold on to those and utilize them throughout the whole year, not just read them one time and throw them away. So the Chamber directories are still coming out this year, and we're hopeful to have them at the Chamber picnic in June. More to be announced on that. We are still online for the April 30th deadline for the Chamber scholarship. So if you know anyone that has not completed their application yet, please have them get that information to us. Since Mount Carmel High School in the District 348 has not made a decision on exactly what's happening with graduation and awards night, we went ahead and kept our deadline just in case things work out for them. We want to be on track with the scholarships as well. So also, like Mayor Judge had said, we are just kind of waiting to see enrolling with the pensions when it comes to Ag Days. It is scheduled for July 29th, 30th, 31st, and August 1st. There's really nothing we can announce at this point. We're hopeful, but we are still waiting. So those are the updates from the Chamber office. We do have some chats here. Yes, we can. We can have Tina talk about what her updates are at Oakview Heights. Tina, are you there? Trying to unmute you. Tina, are you there?
Yes, I'm here.
Can you give us an update at Oakview Heights?
Well, currently we are still under lockdown. We're still following all of our protocol. We are still taking admissions. However, when they come in, we follow a strict COVID-19 protocol. They are under a 14-day isolation when they do come in the facility to keep them away from all of the residents that are currently in the facility, just as a precaution, even if they are out with a negative COVID-19 screen. Oh, I'm trying to think. Sorry, you kind of caught me off guard.
You guys did a good job of letting visitors come and, I don't know how to put it, so stand in the yard and visit through windows, or I saw one case where there was a baby that had been born and they were able to go to the door and meet their great grandmother for the first time through, proper precautions and such. So I think that has been really good to see that community outreach and like people still being able to have some contact without having actual contact. It really helps with people that, maybe are getting a little lonely. So that's been really good.
We are doing visiting. We are doing window visits. We're doing door visits that they schedule. We're also doing video conferencing that they can actually call in, and we'll do the video chat through Zooms. If the families do not have capability to do the Zoom, I've been letting them use my personal cell phone. We've been FaceTiming back and forth, different things like that. We are working to do a parade for the residents. I have contacted the police department, the fire department, and the ambulance service. So we are working on getting a flyer and put on the Facebook. It's going to be next Thursday at 2 p.m. We're going to have the families meet up at Wabash College, and we'll have our residents out 6 feet apart in the parking lot, and we're going to let everyone drive through to see the family. We just are asking the families that they do not get out of the vehicle, and that they can drive through. We're going to try to get them to RSVP so we have their particular family members out. It's going to be kind of an ordeal to get everybody out of the building, but we do want them to be visible to their family member. But all in all, everybody's holding up really well in here. We did get okay from IDPH. They are starting a temporary nursing assistant program that will help with staffing. So I know we've got some ads out, and there's a lot of different businesses locally that are not opened, and some of their workers are unemployed. It's an 8-hour class, and then you do 8 hours of on-the-job training. Like I said, it's a temporary position, but you are trained as basically an uncertified CNA, and you'll work with one of my certified staff members during this COVID situation.
Mm-hmm.
So
you guys are hiring a little bit right now.
We are hiring a lot.
Oh, a lot. Okay.
A lot. We're one of the businesses that are hiring quite a bit, because keeping everybody in their rooms to try to prevent any illnesses in the building, it takes a lot more of assistance than what we would normally need. Okay. In addition, we have a lot of families that normally come in to assist us. And right now we don't have that. Okay. So staff-wise, we require more staff at this time, more so than any other business really would. So we have actually increased our hiring at this time.
Okay, good information. Jason, do you have anything to add to that?
No, I think she hit it well. We're pretty fortunate that IDPH came out with that temporary nurse's assistant position. That's going to help us with staffing issues. Like Tina said, with the changes in the activities and things, we're kind of stretched thin with our staff. So that's going to help us tremendously. And, we're just keep praying for all of our communities, hoping that we get through this. And we've got a great regional team that's put together some great policies, and hopefully we can stay COVID-free. We're COVID-free at all of 11 of our facilities throughout Southern Illinois, which is great. And again, we're still praying for all the communities that are having multiple positives. So we're just staying this together and keep supporting local. Anytime you can shop local, shop local. Try to help those restaurants that are still open. And I know it's really easy to sit back and shop and order from online, but try to think of our local businesses during this time, and we'll get through this together.
Thank you, Jason. We have a question for Ryan. Do seniors that do not file tax returns still get the stimulus, and what do they need to apply?
So my understanding on that is if you're receiving Social Security, they're going to kind of merge those lists with the tax return filing list, and that's you don't necessarily have to do anything. one thing that is a little bit of a question. The IRS has a tool out there. It's called Get My Payment. And kind of a related area to that is if you had somebody that hadn't been required to file tax returns for one reason or another, but they're an adult for the last couple of years, and they're not on one of those payment systems, you can go online and put in your information to be eligible for that. Another situation is too, a lot of those came direct deposit, but for some people, if you had a balance due on your 18 and 19 return, your bank information was probably not transmitted to the IRS, and that's the information that they used for the direct deposit. So if you think that you were eligible, but you didn't get one of those direct deposits, it will come to you in a paper check, but you can actually use that tool to enter some basic personal information, and in the end of it, you can put in your bank account and routing number, and then you're supposed to be able to go ahead and get the direct deposit instead of the paper check, which, you know, we all know if we start printing millions of checks like that, it's going to take a while to get through those. So I think anybody that typically has balance dues but thinks they're in the range that would be eligible to get the payment, it doesn't hurt to go out and look at that site if you haven't received it already. So, yeah.
Thank you, Ryan. We have a question for Karissa and or Judy about the cases that are in Gibson County. I think that there has been a total of 6 confirmed and 4 recoveries. So do you have thoughts on that? And, you know, we're closely by that community. We have a lot of folks that work over there. Are there things that we need to be thinking of when visiting or traveling through and around Gibson County?
Would you like for me to answer, or Judy?
I guess if you want to start, and then she can add anything else that she feels
Okay.
fit after.
Okay, sure. So I think the most important thing about COVID is if you feel like you are ill, if you have a fever or any symptoms, and I know it's there's a lot of information and data out there saying that people who are COVID positive may not be showing any symptoms at all, and that's the scary part about COVID. But if you are ill in any way, it's important for you to stay at home and isolate. We should be social distancing anyway, but it's extra important to do that even from your own family to a certain extent if you can for 14 days. So the positives are not overly concerning to me as long as the individuals who tested positive are listening to the advice being given by the health department and from the hospital to make sure that they're isolating themselves. And one of the big pieces of our response to COVID is making sure we're working very closely with the health department, and we're both monitoring the patient to make sure that they're going to make a full recovery, and to make sure that we are communicating effectively that if they need any type of follow-up care, how to get that care, whether it be a virtual visit or whether it be through the respiratory clinic, where we are aware of the individual coming back to the facility so we can be protecting other patients and our own staff here at the hospital.
Judy, do you have anything to add to that?
The only thing I would add is what I mentioned earlier. If people are traveling to areas where there's a more condensed population, or you're at Walmart and it's crowded, that you might want to consider doing, you know, make sure you do your social distancing, wipe off the cart, you wear a mask if you feel comfortable doing that. And again, I think just going out for what you absolutely need, not just to go out for the fun of it.
Okay. That looks like all the questions that have came in. So we were going to go ahead and thank you all for coming. It was very informational. I think it's a lot of good information that we can all be using in our day-to-day moving forward. And stay safe, like we said, wash your hands, and we hope to see you guys all again soon. Thank you so much to our panel.
Everybody stay safe.
Thank
Thank you. Appreciate it.